That is medical termination of pregnancy. What's a medical termination of pregnancy? You know, now there is actually a concept once people have pregnancy and that pregnancy can be terminated. And what's the cause behind the termination? So worldwide, there are actually nearly 20% of the total pregnancies which get aborted. So you can understand the number of the MTPs is 40 to 50 million per year. So this is actually a very alarming data available, and this alarming data available, total pregnancies which get aborted worldwide, they're 20%, 20% of total pregnancies. So total number of pregnancies which get aborted annually, they are actually 20%. And 42, that is the number of the MTPs which are carried out is 40 to 50 million per year. It is 40 to 50 million per year. Per year. So that means termination, medical termination of pregnancy is actually a voluntary, or it is defined as a voluntary or intentional voluntary or intentional abortion. Voluntary or intentional abortion. So this is the method by which it's performed to end pregnancy. So voluntary or intentional abortion, or we can call this method as a method by which the pregnancy is terminated. So medical termination of pregnancy is now a condition in which the pregnancy is terminated. Pregnancy is terminated before the completion of its full term. So that means that during you can understand during gestation period, if there is actually a baby which is developing in the mother's womb, so it is intentional termination, or it is voluntary termination, can be called as abortion, or we can also call it as a medical termination of pregnancy. And so that means in medical termination of pregnancy, pregnancy is not allowed to reach its full term. So pregnancy is aborted. So this abortion will be induced abortion, and it will be the main purpose of this will be main purpose of this will be to end pregnancy before the completion of its full term. So pregnancy is terminated in this process. So simply you can understand. So simply, if you want to remember in your words, medical termination of pregnancy is actually a method by which the pregnancy is intentionally or terminated or aborted, and the pregnancy is not allowed to reach to its full term. So, there are actually various causes of this thing, various. And now the question here arises, what should be the, is it legally, is it medically allowed to terminate the pregnancy? Is it legally allowed to terminate the pregnancy? So I would like to tell you that in India, there is actually a law, there is an act which is called as a Medical Termination of Pregnancy Act 1971. So that is called as MTP Act. In India, there is an act which is called as MTP, Medical Termination of Pregnancy Act. So there is an act here, which was actually Medical Termination of Pregnancy Act, MTP Act. And it was enforced in 1971 and has been amended in 2002 again. It has been amended in 2002, amended in 2002. So we call this as Medical Termination of Pregnancy Act 1971. So I told you that the figure is alarming around the world, that 20% of the total pregnancies, they are terminated. And per year, you can say 40 to 50 million pregnancies are terminated per year. So you know that there are certain things where the medical termination of pregnancy is allowed, but you know there must be certain reasons. One of the reason is there that uh, if the baby which is growing or within the womb of mother, it's having some genetic disorder, that serious genetic disorder, you know, maybe one of the cause, or there is actually a, because of the pregnancy, there is a risk to mother's health. Under those cases, that medical termination of pregnancy is allowed under those cases. And similarly, one more thing, one more para of this act is that medical termination of pregnancy is also allowed, that if a woman is not willing, you know, if this if this is actually a failure of contraception, if the pregnancy is the failure of contraception, and a couple does not want to have the child, so at that time, this can be also, this also becomes a reason to terminate the pregnancy. Clear? So this is these are some of the important things. And now, what are the various things which are actually covered in this MTP Act? You see, so MTP Act is actually an act, and there is one more act which is called as a PNDT. PNDT. MTP Act stands for Medical Termination of Pregnancy Act, and I told you that this act was, it is actually, the act was uh, in India. This act was enforced in 1971, and from that, this has undergone amendment in 2002. It has also undergone an amendment. So under this act, the termination of pregnancy can be done up to 20 weeks. Remember, up to 20 weeks. Although the safety is 12 weeks. But this can be, there is actually a green signal, and this green signal can be up to 20 weeks. You see the 20 weeks time. Under this act, any pregnancy which is to be terminated, I tell you that the safe period to terminate any kind of the pregnancy is 12 weeks. 12 weeks. That means it's a first trimester safety. However, it can be, according to medical termination of MTP Act, Medical Termination of Pregnancy Act 1971, the termination of pregnancy can be done up to 20 weeks. It can be done up to 20 weeks. I'm not explaining first method, but first why there is the termination of pregnancy is allowed in India. And in India, there is a full-fledged act regarding this. Under this act, termination of pregnancy can be done up to 20 weeks, although up to 12 weeks, it is considered as safe in first trimester, because there is no intimate connection between mother and fetus up to 12 weeks. However, this becomes sometimes very important to terminate pregnancy, as I already told you that there are certain clauses under this act that termination of the pregnancy can be done if the child which is growing in the womb of mother is malformed, congenitally malformed. That means it's having some serious congenital disease, and that can be confirmed with the help of ultrasonography, and that can be even confirmed with the help of this. We can call this. This can be even confirmed with the help of amniocentesis technique, or ultrasonography. So there are various diagnostic techniques available. I have made it clear during developmental biology. I told you that one of the technique that is here, that is known as amniocentesis. And one of the technique which is also available here, that technique is known as amniocentesis, and there can be USG, ultrasonography. So, etc. There is a chorionic villus sampling, and if the child is a malformed, congenitally having some serious congenital disease, like Down syndrome, like you can understand Klinefelter syndrome, various hot abnormalities or various organ abnormalities which are right from the birth, or the child is the result of RAP. If the child is the result of RAP, and it may be because of also the failure of contraception, clear, or it can or likely to harm the mother. So it is either likely to harm the mother, kindly remember. So this MTP Act is a very, very important act that provides us some of the clauses under which the medical termination of pregnancy can be done. So medical termination of pregnancy Act 1971, which has been amended in 2022, this allows the termination of the pregnancy can be done up to 20 weeks, although up to 12 weeks it's safe. In the first trimester it's safe. Why it's safe in the first trimester? Because there is no intimate connection formed between the mother and the fetus. And under this act, I'd like to tell you that which type of pregnancies are allowed to get terminated, and that termination can be done only by a professional health expert. Professional health expert. Otherwise, there can be the serious risk to the mother's health. And under this act, I tell you the point number one that that can be, you can understand point number one, which is allowed here under this act, which types of pregnancies can be terminated. So remember this thing, I'm just writing down one point number one here, that under this act, which types of the pregnancies can be terminated. Number one, if the child is having serious congenital disease, and or there can be serious genetic disorder, it is the child see the genetic disorder that will lead to the dependency of the child, and then there is a third condition in which it's you can understand, if the child is the result of the RAP, child is the result of RAP, child is the result of the RAP, and or you can say it's a failure of contraception, result of failure of contraception. Or point number 5, you can say that there is a so the likely risk to mother's health. So that means the mother cannot bear this child, and it will pose a risk to the mother, a risk to mother's health. So these are actually the clauses under which that this act explains that how you can understand. But you can understand one of the reason behind this is there is actually a law, you can say, that is called a PNDT Act. PNDT Act is another act. I would like to explain it here. What's the PNDT Act? PNDT Act is, so because sometimes these medical termination of pregnancy, it is misused. PNDT Act is behind this. That is called as a prenatal diagnostic technique. Prenatal diagnostic techniques Regulation and Prevention Act. Regulation and prevention of misuse. Prevention of misuse. Act 1994, and has been amended in 2003. It has been amended in 2003. So, under this act, it is banned that if any clinic who are going for, you can understand, ultrasonography and various types of the prenatal diagnostic techniques like amniocentesis, that if they determine the sex of the baby. So if they determine the sex of the baby, this can be, that there are some, societies where the female feticide occurs. Female child is, terminated with the help of medical termination. So this is the misuse of the medical termination of pregnancy. This is the misuse of the prenatal diagnostic techniques like amniocentesis and like ultrasonography. And if with the help of these techniques at any clinic, the medically the sex of the baby is determined to their parents, and if it is a female child, and the most of the families, they go for the female feticide. So this is a very, very serious act, and that's why this act has been passed to punish those people if they go for a sex determination. And the punishment in this act will be the jail for 5 years, and a fine of 100,000. That means 1 lakh rupees, along with the cancellation of, you can say, cancellation of a medical registration. Cancellation of medical registration. So this is actually the PNDT Act what says, and that's why this act is actually has been passed, because medical termination of pregnancies were randomly done. And this act also says that the medical termination of pregnancy can be only done by a healthcare healthcare professional, not by any Tom, Dick, and Harry. So this is actually this was under this. Now I would like to tell you what's the method. What are the methods of the medical termination of pregnancies now? So medical termination of pregnancy methods, we have actually MTP, that means how it is terminated now. So how medical termination of pregnancy, what are the methods in it? One of the method, there are 3 methods under this technique. One of the method is, you can understand, in which, simply, that's actually called a medical abortion. Some drugs are given, they are called as abortifacient drugs. Abortifacient drugs, or you can say, abortion pill, which is used. So this is one of the method, the abortifacient drugs, or the drugs which can induce abortion, abortifacient drugs. And then there is actually a surgical removal, surgical method. And this surgical method, this is called as DNC. DNC. I will explain what's the DNC. This is called a dilatation of and curettage. Dilatation and curettage. Dilatation and curettage is actually a method in which curette is used for termination of pregnancy. So we call it as a dilatation and curettage. And then there is actually another called as vacuum methods. Vacuum methods. So in this category, I would like to first explain that what is actually medical abortion, and during first 12 months, how it is safe to terminate the pregnancy, and what are the medicines involved, what are the abortifacient drugs. Those abortifacient drugs, they will include, so in medical abortion, the medical or abortion pill or the abortifacient drugs are used, and the drugs which are used, which are recommended here for the abortion methods in case of the medical abortion during first 12 weeks. 12 weeks when the medical termination of pregnancy is done. And this is done by providing some special medicines, and the medicine regimen which is used here, that is actually known as one of the medical medicine or abortifacient drug is one is mifepristone. Mifepristone, and followed by misoprostol. So mifepristone and misoprostol, so they are actually abortifacient drugs. First mifepristone is given, and then it's followed by misoprostol is given. And this misoprostol is a prostaglandin. It's a prostaglandin. You can see this is a prostaglandin. And then there is mifepristone. Sometimes misoprostol is given. In another methodology, misoprostol, and another drug which is called as plus MTX. MTX stands for methotrexate. It stands for methotrexate. MTX drug, which is actually a cytotoxic drug, and misoprostol, which is a prostaglandin, because prostaglandin brings about uterine contractions, and so this can be used for safely terminating the pregnancy. Clear? Misoprostol and methotrexate, and you can understand, or you can understand there can be misoprostol alone. Another method is misoprostol alone is also given. So this is actually how the medical termination of pregnancy is done with the help of the abortifacient drugs. So these abortifacient drugs can be mifepristone followed by misoprostol. Misoprostol plus MTX, also called as a methotrexate drug, which is a cytotoxic drug, and misoprostol is also used alone for the termination of pregnancy. Now, I would like to tell you, I will take you to the point, which is you can note also these are the abortifacient drugs, and here we have the methods for medical abortion. The drug is mifepristone followed by misoprostol, and MTX, methotrexate, followed by misoprostol, and misoprostol alone. These are actually the various drugs that can be used for medical termination of pregnancy. So this is these drugs are known as abortifacient drugs. Okay, and then we have one more method, which is actually known as DNC method. So DNC, in DNC method, what happens? The dilatation of cervix is done. Dilatation of cervix is done, and then curettage. A curette is a sharp device that is used for termination of pregnancy. So first there is a dilation, widening or opening of the cervix. So dilation of the cervix is done first by a medical expert, most probably a gynecologist, or you can understand our midwifery, trained professional, surgical removal of the part of the lining of the uterus. See, surgical removal of the part of the uterus and contents of the uterus by scraping and scooping this is called a curettage. Remember, this is the curette, and it is a therapeutic gynecological procedure, as well as the most often used method of a first trimester miscarriage. So first trimester miscarriage or abortion. So this method can be used by the doctors in a normal routine. Sometimes there are missed abortions. Fetus is in the womb, develops but does not develop the heartbeat, and then under this condition the doctors have to terminate the pregnancy by using the DNC method, by first dilating and this is the diagrammatic method. You'll see that this is actually a curette here. This you see that the method is surgically, this is vagina, and this is vagina. See, this is vagina, and this device is inserted, and this is the curette. You can see this is the curette, and this is cervix. Cervix dilation is done first. Cervix dilation or dilatation of the cervix is done, and then we have here this structure is called as a curette. And this is a sharp this curette, with the help of this scraped, this tissue is scraped, contents of the uterus by scraping and scooping. So this is the curette, and this method is called as a dilatation and curettage method, or also called a DNC. So this is the DNC is a safely done during the first trimester. And here you see the devices which are used by the doctors or professionals for terminating this type of pregnancy. And then last we have I told you again, you must remember the pregnancy termination is safe during the first 12 weeks. However, according to the Medical Termination of Pregnancy Act 1971, this can be medical termination of the pregnancy can be extended can be carried out up to 20 weeks of pregnancy. So this is you can understand very, very important to know what is actually this act all about and what is termination of pregnancy. But I told you that if the medical pregnancy, termination of pregnancy is done on the basis of the sex determination, and if there is a clinic that have undergone the sex determination and they are leading to the female feticide, so there is actually act as a PNDT Act, Regulation and Prevention of Misuse Act, prenatal diagnostic techniques like amniocentesis and ultrasonography. If they are used for the sex determination, so that doctor can be jailed for 1 month. There's 5 years with a penalty of 100,000, that is 1 lakh rupees, and with a and to the contravention of this law, there can be also the cancellation of his registration. And then we can understand vacuum aspiration method. So vacuum aspiration, then with the help of the vacuum, the pregnancy is sucked with the help of the vacuum. And there are 2 kinds of the vacuum aspirations. One is the manual vacuum aspiration, and then there is a second that's called electronic or electric. Suction is done with the help of an electric device, electric vacuum aspiration. So this is about a third method. How? So 3 methods I explained. One is called aspiration method, and then medical termination of pregnancy done with the help of DNC method, and third is done with the help of abortifacient drugs. I hope that this is clear to you. This was our